Hi viewers, this is Dr. Umesh from Win Hospital, Hyderabad, and our special greetings from Win Hospital. So I've been practicing neurology last 20 years. So today I'm going to talk to you about a spondylosis, which is commonly misdiagnosed and misnamed for some of the disease as a spondylosis. Now what is that spondylosis means? Spondylosis is a skeletal abnormality. And what happens in a skeletal abnormality? We have some alignment in the vertebrae. Vertebrae is a backbone and in which the spinal cord runs, and this spinal cord comes from the brain, descends down from a brain. So these vertebrae, in fact, they protect the spinal cord all around its structures. So each vertebrae are small in sizes and they are arranged one over the above like a bamboo, and in between these small vertebrae we have a soft tissue called a disc, and on either side of this vertebrae we have a small roots exiting out of the body, and they are important in functioning of our limbs and then as well as arms and legs, and they control our urine and then the bowel movements and everything. So when they work normally, usually they don't have any symptoms. In a spondylosis, how do the people develop a spondylosis? If you are in one profession which is you continue for a very prolonged time, for example, I'll give you, take a software engineer. Now software engineer is more of a restricted movements, they don't mobile, they're always with a table and then laptop, and then they adopt one posture for a very prolonged time. As a result, the body also gets adapted to the gravity and the muscle stretch, and then they have to align the whole body according to the posture and then sustain that posture for a very long time with the contraction of those muscles. As a result, those muscle contractions will be held for a very prolonged time and they become very, very stiff. When they become stiff, they start pulling that bones which is very near or which it gets attached to it. So if constant pull of that particular bone in that muscle direction, it gets disaligned from its normal posture. The same way, when we have a spine and then it gets disaligned forward or backward or sideways, when it gets disaligned because of excessive movements or because of no movements, as a result, the roots which are exiting out of a bone on either side will get compressed, and this compression causes tingling numbness in fingers, sometimes shooting pain, dragging pain, pulling pain, and then you'll have a nagging pain in the neck. So this itself indicates it's an early stage of a spondylosis. That means that your skeletal arrangement is disaligned. So this is the right time we should get adapted to a regular exercise, stretch exercise, physical therapy, regular walk, and then this can be controlled at the initial phase. When we ignore all this, we'll land up either into a direct nerve compression. As a result, you'll have uncontrolled pain where physiotherapy has got a least role and medicine has got minimum role. Medicine is given only as a symptomatic treatment where the pain can be reduced for a certain time. When the drug wears off from the body, again pain reappears. So what we have understood now, at this initial reversible phase, it can be controlled. When it becomes irreversible, immediately you need to see a neurologist. A neurologist will identify what is a precise problem and then what is the remedy for it. If it can be manageable with a simple exercise and then as well as correction of the alignment, then he will take help of a physiotherapist and try to help you out in overcoming this problem. When you are beyond this problem, then you need to see a neurosurgeon there. Neurosurgeon, either he decompresses it or he will try to put all those bones which are disaligned into aligned position. There is limitations in that. We cannot get completely controlled with this, but all these specialists, physiotherapists, neurologists, neurosurgeons, they'll try to help you in some manner to bring you back into a normal lifestyle. So my request to you all is, I think earlier identifying the disease and preventing the disease is much better than taking a treatment and getting surgery done for this disease will be much more difficult. Thank you very much for viewing this. Our greeting from Win Hospital.